And those doctors have said that they themselves have still been offering services. They just want to know whether they will get an opportunity to serve in Nairobi County government. We have consulted with the board, and I've reiterated the commitment that I had made. Of course, you understand that the employer is the Public Service Board, but we have implored upon them, just as you've done in other cadres, that you first start with those who are in your facilities, who have been offering services, who have been, providing much needed healthcare to the people of Nairobi County. We have been following the process in the courts, including the directions issued today by Justice Baram Ongaya, and we are telling our officers, because I have told my CEOs to be on standby, because we need our hospitals full of medical personnel. I have given the doctors in Nairobi 12 hours to show up in our hospitals. Those who want to continue working with the County of Nairobi have 12 hours to show up in our hospitals, because the mandate I have is to ensure that I provide health care to the people of Nairobi. The only concession we can give is if there's that early morning meeting, and then we start at 9 a.m. I want to thank sincerely some of the consultants, some of the medical officers, and even our local doctors and nurses in our facilities who have continued, despite pressure, have continued to give much needed health services to our people. And what we have told, because many of the issues in Nairobi were that the recruitment of these medical officers who had previously been serving in NMS continue. But that process had been stopped by the doctors themselves when they went to court because of not being sure of whether or not we will absorb them. We have told them that the law must be followed. We've asked them to get out of court so that we can hire. Serekari ya Nairobi haijakosea madaktari wetu, but kuna vitu ambao tunafanya pamoja. So I'm not trying to de-whip anyone, but I've advised them that my position also, because I'll be de-whipped by the people of Nairobi, for using their money to pay people who are not in hospital, for having used their money to give insurance that is being asked for. Insurance is the reason for the strike. I'm spending more than 2 billion on insurance. So why should you strike and I've given you insurance? I'm paying your salary on time. There's commodities in your facilities. I am on the process of hiring more that you want, but you've stopped it. So I've just given them the option of coming back to work tomorrow. And I'm sure we will be able to, and we work very closely. So they have the right, of course, to refuse my offer. But I've given them an offer, remembering we're in a recruitment process. The goodwill I've extended, how it is responded to, determines how we move forward. That's as simple as it is. But I will not negotiate like a deck of cards the lives of Nairobians. Apart from the issues that relate to another employer that I cannot guarantee you, and I have no contract with you to provide interns. I have no contract with you to provide what national government must provide, but I have a contract with you to pay you on time, to make sure you have the right staffing, and if I provided everything that is due to you, and you choose not to go to work, then you're absconding duty. It's as simple as that. And many of them want these jobs, they themselves. So that process is going on, and my goodwill to them is to see, because I have given them commitment, that all of them who have been working with us in fact, will all be absorbed. That is my commitment, and that's what I've asked the County Public Service Board to do. Of course, I don't direct the board, but they understand that if you had been there internally, our policy as a county for all recruitment is first priority is given to those who are serving internally. That is a county policy in our HR policy. And I've said that policy must apply in this case. Now that offer that I've given, you've made it now 11 hours. Munapunguza. It is reducing in time. I want to release the national chairman and the secretary to go meet their membership, and also to consult with the leadership. And I've advised them, because I'm also a unionist. I used to be. You know, I was the patron of all the watchmen in Kenya. Yes, the Private Security Workers Union is a very serious union with 450,000 people. and 250,000 in Nairobi. It is a serious one. Tunaweza funga hii mabarabara. But as a unionist, I know that sometimes when there's pressure from the national, you can show solidarity in a different way. Say, okay, my employer, especially when you have a different employer. For me, the issues of Nakuru County, or Mandera County, or Nyeri County should not prevent me from delivering health services to the people of Nairobi County. And that is why health was devolved. Because our counties are unique, and the needs are unique. So this is the Nairobi position that we've been able to give. Thank you so much.